Well, I arrived here in 1984, and shortly after arrival I brought one of our technicians from my training program, and he came to help out with setting up a pulmonary function lab, and he and I were both trained in sleep, so we decided to go ahead and generate the sleep lab back in we started working on it probably in 84 and 85, so we actually had the lab up and going in 1985. Back in those days there wasn't any proprietary equipment to utilize, so we just had to put the monitoring devices together on our own. This whole field of sleep disorders has really blossomed, largely because the numbers of people that we anticipate have problems with sleep apnea and the impact that it has on their life, particularly strokes and heart attacks.
Sleep apnea is becoming more and more frequent. It can certainly interfere with quality of life as well as cause other health symptoms or other health issues. But if your oxygen level falls at night, your body tends to release adrenaline, which raises your blood pressure, puts a strain on your heart, can lead in the long run to heart attacks and strokes.
It's often the bed partners complaining, right? You're snoring too loudly, I'm having to nudge you because you're not breathing. So the pauses in breathing are just loud gasping, choking, lots of sounds, restlessness, and waking up feeling just as tired as you went to bed. So lots of sleepiness, fatigue, and just a general sense of functioning in a fog, memory fog. So lots of cognitive impairments we're seeing.
Back in the day, we thought we were just dealing with snoring and the cosmetic aspects of sleep apnea. However, over time it's become quite apparent that the physiology involved with this is quite devastating.
The main symptom of sleep disorders is usually excess sleepiness, but anything that interferes with sleep at night can make you more sleepy during the day. If you are snoring, having those kind of issues, that would point toward sleep apnea.
The most common way we treat is with these airway pressure devices, so often called CPAP therapy. That's just one of the many options. Some people, if it's mild enough, surgery can correct the problem. For some people, the dentist can make these special oral appliances, and they're being made more and more in the area. So there are different ways to treat. And for some people, if it was more of a complaint of snoring and it's very mild, and they're not necessarily impaired, weight loss may be helpful or just observation, but that happens less often.
CPAP has come a long ways in over the years. When I first started, we used a giant blower motor to generate positive airway pressure, and we've gone from that 1.5 horsepower device to very small devices that don't make a lot of noise and can be pretty much taken anywhere. Most often when somebody's first being diagnosed, tell me, well, I could never wear that mask, that's impossible. About 95% of the time, we work our way through that. And eventually they realize that, gee, my life is totally different now on CPAP.
Sleep is very important. We don't fully understand it, but if you don't get sleep, you just don't do very well.